Everyone, thank you for joining us. We're so happy to be here with G-Mobility, even if it's just virtually. And again, just thank you very much for joining us. I'm going to head off to Jeremy, who's going to kick off our morning here. Jeremy, off to you.
Morning, Amy. Morning, Tilly, and morning, everyone out there. Thanks for joining us in these challenging times. I saw the attendees list, and there's a lot of people from Victoria and a few from further abroad. So the joys of a webinar, we can have people from everywhere attending. Welcome. So I'm Jeremy. I'm one of the directors at G-Mobility. And we're very fortunate today to have Amy running a clinical education session that's going to cover off on some manual wheelchair considerations, and hopefully also get into a bit of information on power assist systems. So very excited. I was saying to Amy before that when I first started out, I was a wee little whippersnapper. And she was just so helpful in really showing us the ropes here at G-Mobility when it came to rehab equipment. So I'm always excited to have her come and speak to us. So over to you.
Thank you. And always excited to see how you guys have done so well in such a short amount of time. Before we get started, I'm also going to introduce Tilly here, who's with me in Sunrise, in the Sunrise Studios, if you will, where we'll try and do some live activities. Just realize we're not camera people, so we're all learning, and we'll do the best that we can. Tilly, if you'll sort of.
So I'm Tilly. I joined Amy here at Sunrise coming on 4 or 5 months ago now. I'm an OT with 10 years experience, predominantly in wheelchair and seating. The last 5 years I've been working in Singapore and New Zealand and have a background in brain injury rehab as well. So I'm an addition to Amy here and an extra contact to help you with all your seating and posture and wheelchair needs.
Very good. And just a quick description of myself. Have been with Sunrise just about 20 years actually in both the United States and in Australia. Have been here just closing on 13 years. I do the clinical application webinars such as this. Basically, Tilly and I, our role is to help people understand what our products can do, maybe what they can't do, the clinical applications of them, and help the therapists with assessments out there. While we've been in these sort of COVID lockdowns, we're not so much able to travel, but have been doing client assessments via webcams, helping out with order forms, tricky clients, troubled prescriptions, whatever. We're here to help. So we'll give you some of those email addresses at the end of the webinar here. So please reach out. We're here to help. We want to make this process easier, more efficient, more successful, no matter what sort of product we're talking about in that field of assistive technology. So hopefully my screen will now show. Yep, good, excellent. And Scott is also the sales rep for Sunrise Medical. He's in Melbourne as well. He's self-muted right now. Give him maybe the opportunity to jump on. Hey, Scott.
Morning. Morning. How you going?
Seamless. Very good.
Morning, Scott.
Morning, Jeremy. How are you?
Doing very well, thank you.
Good
Can
stuff.
you introduce yourself to the crowd?
Yeah, so I'm a rehab engineer. Recently joined Sunrise Medical as an area manager back in November last year. Obviously working in some kind of unprecedented times at the moment, but yeah, obviously here to support G-Mobility and therapists alike in the field with regards to just education and knowledge with regards to our product application. And here to answer technical questions or any help you might have when you need me.
Excellent. Okay. And maybe go off mute just for a bit, Scott, and or go back on mute, and we'll take it here for a bit. Cool. Everyone else, you are on mute. We just think it's going to make it a little bit less chaotic, just in case people are at home with kids or dogs or other exciting things happening. But we'll take a break, probably 40, 45 minutes in, and also people will be gathering your questions. So you'll see a chat box over to the right probably of your screen. You can put some questions into that, and we'll answer those either along the way or at the break in about 45 minutes. So today really is about successful manual wheelchairs and what we need to think about in the assessment process, what we're trying to manage to do, and then also build into the system that we're thinking about potential, we're thinking about long-term approaches to this mobility, making sure that people can be as effective, as efficient, while saving their arms, you know, avoiding overuse type of injuries. This is my friend Danny. I had a great opportunity to go with Danny many years ago to Vietnam, to Ho Chi Minh City. And he's at the top of their wheelchair ramp that they have at the hospital for people with spinal cord injuries in Ho Chi Minh or Saigon. And, you know, he was in an RGK chair actually, but he was in a really sporty, super well-fitting chair, and he could zoom up that thing. The chair fit him like a glove. And meanwhile, you know, I've sort of cut the people out of the picture. They were in steel hospital chairs, and they had just gotten their injury, and they're looking at him like, oh my goodness, that can't be possible, right? But just shows you what the potential is if we give people the appropriate equipment and sort of give them the notion of what's possible. So don't forget, especially if we're talking about a traumatic injury, that a lot of these people were you and I before, and we really are striving to get them back to the lifestyle that they once had. So create that potential energy, not only in their equipment, but in their mind space, really. I'm working with a new mouse. I'll figure it out there. You know that if we don't do this correctly, or if somebody doesn't get the right piece of equipment, it can be really life altering. Again, this is a gentleman that had a traumatic injury, he had a spinal paraplegia. And so when he's set up in a chair that isn't exactly great, it's not a good fit for him. And it's a good chair, it's a quickie too, right? Great chair, but it's set up to be more like a dump truck than something that's easy to push. And so as a result, he comes up with these compensations in terms of pushing strategies. He compensates in terms of his posture. And what the end result is he's going to get a poor posture. He's probably going to get an overuse injury at his shoulders, maybe even at his wrists. You can see he's got a long footprint to that wheelchair. So it's not going to be easy to push. It's not ergonomically put together for him. He's also an interesting case in that he started sitting a long time after his injury, or most of the day, and he started getting all these migraines. He'd never had a migraine before he had a spinal injury, so he just thought they went together. But you and I can all see that migraine is because all those subcapital muscles in his neck are doing a job that they weren't meant to do. They're really having to statically hold a pretty crummy posture. And so immediately a better posture is going to get rid of those migraines. So, you know, that's really the importance of making sure that our clients are set up well, especially in this active arena when people are sitting all day long for hours and hours, and for the future, right, for years on end. And the end result is overuse injuries, probably, poor pushing strategies, poor mobility, and a loss of potential. I've included a lot of the investigations and the research papers here, telling us what the evidence tells us, but I'm going to really drill it down. I'm going to deduce it down to, we're looking at the ergonomics of a push, somebody pushing the wheelchair full time with their arms. I want you to try and have them hit that wheel the fewest times possible, with the least amount of force possible, and trying to avoid extremes of ranges of motion. So that means we don't want a lot of shoulder extension. We don't want a lot of shoulder elevation. We don't want a lot of positional shoulder flexion. We don't want a lot of wrist extension, okay? And that really has a lot to do with how people are positioned, what their posture is within that frame, and then also the configuration, if you will, of how that chair is made, okay? So hit the wheel the fewest amount of times possible to go the given distance, the least amount of force possible, and also do it from a good posture, avoiding extremes or ranges of motion. Okay. And then it also, the evidence is telling us that it does matter what kind of materials and how those materials are built. Obviously, high quality materials are going to be more durable. They're also going to have a better fit together so that there's less movement between those parts, and it's going to be a direct energy transfer between the push to the chair to the movement. Okay, so that's really what we're trying to provide, again, in this really active rehab space. And then if it can fit well and they're able to access those wheels, it can become sort of an extension of their body. And Danny, in that first picture that we showed, he turned his head, the whole chair moved. He turned his shoulders, the whole chair moved. It was because that chair fit him well, like a glove. It was an extension of him. It responded to him. You know, this is a great action shot from our marketing team, but this is what a lot of our clients need to do in their active wheelchairs. They need to manage 2- and 3-inch curbs. They need to go uphill, downhill, over uneven terrains. So that means that we need a chair that's responsive and able to move around those uneven up and down surfaces. First thing I want to talk about is what type of frame should we be looking at? And material is one of the first things that we think about when we're trying to select a type of frame. We can basically make wheelchairs, these active wheelchairs, out of 3 different materials. And I'm going to further divide it into active wheelchairs because, you know, our semi-active or hospital type of chairs, we can make those out of steel because they're much less expensive, because people are just using them part-time. They don't need to get them in and out of a car. Okay, so keep those hospital part-time wheelchairs out of the equation, and then we're really down to 3 materials. Those 3 materials commonly in our market is titanium, carbon, and aluminum. Okay, I've been in Australia for however long I've been here. I still don't try and say it the other way because I blow it every time. So help me translate. Okay. People tend to think that the different materials are going to give a different weight, like one is going to be a lot lighter than the other. We've come so far in our development of chairs that really weight isn't the biggest difference, overall frame weight isn't the biggest difference between these materials. I think it's more about the performance, okay, and what it's going to provide to the client. So we'll start with titanium. Titanium, its weight has sort of a rotational or a torsional quality, and that's how the titanium molecules bind to one another. So it has a sort of absorption, a rotation quality to it. That way it's going to be the most absorptive, probably the softest sort of ride. So for somebody that has a lot of spasticity, somebody that's going over a lot of cobblestones, somebody that has back pain, you might think about a titanium frame because it's going to absorb that road vibration, that road noise. Okay. It's also very, very strong, very, very light, and that's because of its strength to weight ratio and the strength within the material. Because it's so strong, we can have really thin walls in a titanium material, and so that's why it's getting it into that very lightweight category. The other thing that's a really big positive in terms of titanium is that it doesn't corrode. So if somebody's at the beach or somebody leaves their chair outside or you're worried about that corrosion, you might choose titanium as your material. Okay. It's also durable. It doesn't sort of erode and fatigue over time. One of the considerations with titanium is that it does absorb. It's a little bit more giving. So it's not going to be that really rigid ride, and you may lose a little bit of efficiency in the push in that ride if you're using a titanium. Okay. The other consideration for titanium is it's a little bit more expensive. It's a harder material to work on, and so it just takes a special sort of manufacturing process. Okay. When you think about titanium, think about absorption, a little bit of give to that material. If we look at carbon, carbon is on the other side of the spectrum. Carbon is going to be your very rigid ride, really stiff. So the energy transfer is going to be the best. So it's probably your most efficient sort of push, direct transfer of that energy of the push to the movement. It's also strong, but it's sort of unilaterally strong. So we tend to make carbon in sheets. So a foot plate or a side guard. Although we're getting better as manufacturer, our carbon frame, it's called the Krypton, is actually carbon threads that are woven together, if you will, very tightly, that creates one tube of carbon. So that's one thing we want to consider with a carbon frame is that we don't want to have a bunch of carbon pieces laminated on top of one another. And our Krypton is using one long side frame of those carbon materials all weave together to create one very, very strong tube. Okay. Consideration with carbon is that you have to treat it well. Even though we've made that frame super strong in that weaving strategy, I don't want to use a carbon frame for somebody that's going to pull it out of their car, dump it on the concrete pavement, and then drag it along. Carbon frames won't tolerate that sort of transfer strategy, if you will. Okay, so when you think about carbon, the positives, it's going to be a direct energy transfer. It's going to be really super rigid, direct transfer of that energy, super strong, super light. It also doesn't corrode, one of its other benefits. And then if we look at aluminum, aluminum is right in the middle. And our technology with making aluminum, we're able to make the tubing a little bit bigger, broader, bigger diameter, but thinner so that it weighs the same as its carbon and its titanium counterparts. But it's sort of that in-between performance. It's not going to be as absorptive as the titanium. It's not going to be as rigid as the carbon. So this might be for your person that needs a good all-around indoor-outdoor product. They want it to be absorptive, but not too stiff. Sort of, I think of the fairy tale, Goldilocks, that's what I'm thinking of. You know, this one's too hard, this one's too soft. Ooh, that aluminum might be right in the middle for your client, okay? Especially if we're talking the 7000 series aluminum. We don't need to talk about all these materials, but it's just allowing us to take the aluminum, make it thinner so that it equals sort of the weight as its titanium and its carbon counterparts, okay? If somebody is near the water a lot, you might have a little bit of corrosion in the very end of its lifespan for aluminum products. So if somebody's a big swimmer, they're scuba diving every week, you may want to go to a titanium instead, okay? If we look at all those together, we are trying to do a little bit of a comparison here. Again, I guess the take-home message with material is don't just think about the weight. The weight is going to be affected by the options on it, and so much more than just the frame material. Think more about the performance, the durability, the stiffness that it's offering, and therefore the ride comfort and the ergonomics, the efficiency of it, okay? And one of my favorite sayings continues to be, what's most important most of the time? Think about how and where your client is going to be using this chair. And then you can describe the benefits, the considerations, and make the best choice for the client. Then we get a little bit into the design of these wheelchairs. Okay? When we're talking about our active full-time manual chairs, we'll have a rigid version, which means that the frame doesn't fold in half, but just instead, typically the back will fold down on the seat, pop off the wheels, and then load it into the car. It does not fold in half. The benefits of these rigid chairs is that there's less frame, especially the open frame. And when we describe an open frame, we mean one like this. Some manufacturers will call this a Z frame, so it sort of looks like a Z. Or we call it an open frame. We say open because it's missing all the bottom half of that frame. Okay. That way, it makes it super light and super easy to load into the car. Okay. Most of the times, these active chairs, open frames, will have wheel adjustability. We'll talk about that. And they'll have seat to floor height adjustability. So there's a lot of change in your client, change in both posture and in pushing potential that we can do to this, or that we can accommodate in this chair. Okay. Most of them also have some sort of bracket back here where we can change the seat to back angle. We'll go through all these as we move along here. So that's an open frame rigid. We can also make them open frame that for clients that know exactly what they want. So we take away that folding backrest and we take away a great deal of the rear wheel adjustability. Okay, this is going to be for somebody that's been in a chair, 3 or 4 different chairs. They know exactly how they want it set up. They don't need to fold the back down for transfers or transport, and they know where that wheel position should be. They want to make it as lightweight, as durable as possible. So that would be an open frame, rigid, non-adjustable type of frame. And then we can make it a little bit more durable by closing the frame, or for a heavier duty, I guess is probably a better example. So you'll see this is that open frame again, but now we've added a frame component. We've closed the frame down. Basically, that adds another structural component to the upper frame to the caster arm here. It's going to give it better weight capacity or higher weight capacity and probably a little bit more durability. I might go for a closed frame chair for a client that's bouncing down a bunch of stairs. They're going off a curb quite commonly, and that they're at the highest spectrum of the weight capacity of the chair. Okay. Obviously, not all models can do this closed frame, but we're talking sort of generics here. And then in our folding chair range, we also have an open frame version. Again, a folding one's going to fold in half. You just pull up the seat upholstery and the whole thing folds in half. But this open design is trying to better simulate being a rigid chair. I'll tend to use these open frame folders for people that I really would rather have them in a rigid chair, like a 7R or a 5R. But because of their transport, because of their home situation, whatever, they need it to fold. So I'll do that chair, realizing that it's giving them that rigid feel because of how we build the folding mechanism in there. We lock it into the cross brace, we structure it, rigidize it as best we can, but then it still folds for those other transport or transfer issues. You'll also see that the open frame folding chairs have a small cross brace, skinnier, and it's higher to the chair, so that we're still trying to make this thing as transportable as possible. Like the other chairs that we talked about, it will have all the rear wheel and the caster, seat to back adjustability that we saw in the other chairs. And then our traditional type of folding chair, you can see how traditional or closed frame folders has what I consider a box frame construction underneath. So this is going to have a down tube here, a down tube here, and then a cross brace that links the two so that it folds the transport. Nice thing about these closed frame folding chairs is that the majority of them, like our Quickie 2 here, or even the Quickie 2 Lite, it's modular, which means that the rear part of it is separate from the front part of it, that's separate from the cross brace. So that allows me to change it in size and configuration after it's been ordered. So when I think of this closed frame folder, I know that I've got modularity, adjustability, change built into that chair. So I might choose this one if I know imminently in the next year, 2 years, there's going to be a change in size, there's going to be a change in ability. This closed frame folding chair allows me to do that. And in fact, our Quickie 2, our Quickie 2 Lite series, those all come with a 5-year guarantee. We call it the True Fit program. So the first 5 years that the client has the chair, you can have that chair grown or shrunk to meet their new needs. And it means a new cross brace, a new rear frame, a new side frame, front frame, sorry, new hangers, all that stuff is included. We want both you as a therapist and the end user to feel confident that this chair is going to fit for the lifespan of that chair. And we consider the lifespan of most of these active chairs to be 5 years. Okay, so we build in that guarantee. We can do that because we have those different modular parts that can be exchanged. The consideration is a little bit less efficient than its open frame folding counterpart because there's more parts. There's more parts moving on parts, and it's a little bit heavier overall because of that extra frame componentry. Okay, so again, what's most important to your clients? What are the must-haves? We've gotten pretty fancy with some of our tubing as well. Not only do we change the diameter for strength, for durability, to a lot of different materials, but we also can change the shape. A lot of our aluminum products anymore are ovalized tubing. And this ovalized tubing allows us to use less material to make the tubing walls thinner, so that therefore it can be really light. And this is how that aluminum type of frame has come into the same ballpark weight-wise as carbons and titaniums. Okay? I always like to equate it to an egg. If you go into your kitchen refrigerator right now, and don't do it, and you take an egg that's not hard boiled and you take the top and the bottom and you try and squish it together, you're going to have a hard time breaking that shell. And it's that same approach that we use with our ovalized tubing. Okay? We build strength into the tubing by shaping it a little bit differently. Also means we can have less welds, all that sort of thing. Okay, just realize that the engineers of all these chairs are really thinking about the benefits and how they can make the lives of our clients better. We're also changing geometries of these chairs, typically in our rigid design chairs, but we can change where this caster arm is. And that caster arm is really going to affect the stability of this chair in the front, and it'll also affect transfers, especially if you have somebody that's doing a slide-in transfer, slide-out, like into the bed, onto the commode, or into the car. Where that caster arm is will be a big difference between the transfer being pretty narrow or being a little bit wider. So here we've shown that this is our Krypton carbon frame, but it can have a tucked back caster position, and that's going to allow really close access to the car seat, to the bed, whatever, for that transfer. But its consideration is that it's going to be less forward stable versus this one where we've swung out that caster arm. Its benefit is that it's really stable forward. So if I move all the way to the front of my chair to pick up something off the floor, to do a forward transfer and miss the wheel, or to put on my shoes, whatever, that chair is going to be really anteriorly stable. Okay? The consideration is it's going to be a little bit wider at the front. Okay? It's really nice to be able to choose that. See what's going to make the biggest difference for your client. And our 7R product, the one pictured here, actually has one in the middle. Like, oh, this one's too narrow, this one's too far out. Let's go smack in the middle. Let's take the middle road. Back to the whole Goldilocks, it's sort of phenomenal, right? Okay. So that's the caster arm position is what I call that. And then we get to the sort of frame size and how we want to build it. This is when we have to take into account our client's measurements and then translate them into the wheelchair measurements. Now what we'll do here with Ms. Tilly is we'll take the client measurements and then think about how we might translate those into the actual wheelchair measurements. Okay? Couple key things. We didn't add the measurement chart to the list of handouts. Perhaps we'll do that as a follow-up. We've made some really nice measuring guides. We've also made a really nice measuring video that we could send through to help you out if you're newer to this. These measurements will really help you get an appropriate size wheelchair. Remember that you want to measure the client in the posture that they're going to sit in, okay? It's great to do a supine assessment, especially if the posture is a bit complex, so that you know sort of what posture they can attain and maintain. Probably most importantly is we want to take these client measurements outside of their current wheelchair, because they could be sitting like this because of the wheelchair, not because of their body. We also don't want to take these measurements in their bed. I've been forced a couple times to take client measurements in supine, and they're so inaccurate. We're just a different size and shape in supine without gravity than we are when we're sitting and in gravity. Okay. We have a little table that we've used here. It's a nice firm surface. It's a good seat to floor height for us. Kitchen chair. If you are doing a lot of these assessments, maybe you could get a little yoga mat or massage mat and have that be as your table. Think about the clinics that you can get into and do these measurements. As a last result, a kitchen chair or their wheelchair. Just make sure that you've addressed their posture, how you want it to be before you start to take those measurements. Okay, so we'll start with hip width. And so I guess everybody, if you'll just, we'll do these live. If you can make your camera a little bit bigger, or we'll just stop sharing my screen maybe. Not sure how I want to do it. Everybody can just make your video screen bigger if you can, and then you'll be able to see what we're doing. There should be a white horizontal line that you can drag down and go half video in my slides. Okay. So in terms of hip width measurement, if you have a set of calipers, those are helpful. Tilly, tell us about the clinical newsletter these guys probably got in the quiz and how they can get their own set of calipers.
In the newsletter that should have hit your inboxes yesterday, there is half a dozen clinical questions, and if you want to answer those and email us back, we will select 3 winners at random to win calipers, which is really handy. So if you would like a newsletter, if you didn't receive one, let us know and we'll send it to you.
And then send back the quiz and you could win your own set of calipers. And their calipers, they are about 22 inches in length, just about 60 centimeters, I think. They're nice, they're mobile, they do a really nice job of measuring width, heights. So we'd be happy to share those with you or send you a pair of those if you win our quiz. If you don't have access to one of those, go to Bunnings or a stiff measuring tape. I tend not to use a cloth measuring tape. It just doesn't measure as well accurately as a more stiff metal measuring tape. Okay, and so what we're going to do here, like we showed in the last slide, we're just going to measure across at her widest point. In the picture here, we have used file folders. A clipboard is a really handy measuring strategy so that we can just measure across that. Or you can use your hands, and I'll typically use my index fingers and then measure across as my caliper arms. Okay? So straight across. I'll tip it up a little bit so that you can see. Again, if she's really windswept and I can't manage that posture any other way, you'll have to take widest part to widest part. Or if somebody is very different in terms of their leg position, I might take a hip width measurement and a leg width measurement. Do that wide out for us again. Just move my camera a smidge. Jeremy, how we going? We all right?
Looks good.
Okay. So make sure that you're not bending around. It's going to make your wheelchair too wide. Measuring straight across. And again, I think that's why those clipboards or file folders are very helpful. Okay. And then when we translate that into a wheelchair, Our wheelchair measurements are taken from outside of the tubing to the outside of the tubing. Hopefully we can see well enough in our green version here. All of our quickie chairs are going to be, the wheelchair measurement is going to be from outside of the tubing to outside of the tubing. Okay. In our active upper extremity self-propellers, we probably want client measurement to equal, client seat width measurement to equal the wheelchair width measurement. Okay. With pediatrics, you might want to add a little bit in. With geriatrics in sort of a more standard chair where they come in 16, 18, 20, you may want to go to the next size. But if Tilly is measuring 15, I'm probably going to give her a 15, and she's a paraplegic. I'm probably going to get her a 15 wide chair. Okay. Do take into consideration any contouring that you're going to put into your seat cushion. Also consider side guards, that sort of thing. Will they take up space? Another important thing to remember here when you're taking these measurements, if you're a clinician, your job is to be able to recreate the client. Then you can have those discussions with Jeremy about what they do, what their diagnosis is, and Jeremy and his team are going to help you translate that into the wheelchair measurement. We're all in this together. Clinicians, we're in charge of client information and getting the sort of the generic information from them. And then the supplier can help us translate that into an actual thing. And then if I put my Sunrise hat back on, I'm hopefully making sure that we're producing products and educating you guys about what they do. Okay, but we're all in this together with that client-centered approach. Okay, so that's seat width. Seat depth. Again, use your file folder. That'll give you a really nice mechanism to measure from. If Tilly goes into a lot of posterior pelvic tilt and that's the posture that she's going to be in, make sure that you take that measurement, okay? Otherwise, our seat depth is going to be too small. Okay, so here we can just use, hold that for me. She's a great client, okay? You just put our straight edge to measure from, and I will typically take the measuring tape, the silver end, and measure it from my rigid back, and then drop that measuring tape, put my finger in their popliteal crease, and then measure just to the front of my finger. Okay? If she is in a big posterior pelvic tilt, make sure that you are taking into consideration how much back depth that's going to take up. Then we might need that now to be our seated depth, okay? Make sure that you are able to measure them in the seated posture that they'll best be able to sit in, okay? And then when you translate that to the wheelchair measurement is from the front of the back cane to the end of the seat upholstery. Realize that your rigid backrest typically will take up an inch of seat depth. So put that into the equation. That's where the G mobility guys will help you out in the translation. And then depending on the amount of pressure distribution you want to create in your client, will depend on how much you want to back off the seat depth of the wheelchair compared to her leg length. Her leg length, let's say, was 18. If she's going into an active chair, I'm going to see it again. If she's going into an active wheelchair, she's got really good skin, she's in her 30s, she wants her legs tucked back in, I may reduce the depth of that wheelchair by inch, inch and a half, maybe even 2 inches, okay? Because I want that tucked position. Remember that I do have some extra frame ability here. I can build in a little bit longer, a little bit shorter, depending on the frame that you're choosing. Okay. But typically active chairs, I'll think about seated depth -1 inch, maybe even -2 inches.
Sorry, Amy, do you just want to go into a little bit under what circumstances you would build in extra frame depth? I think that's an interesting topic.
So, grab that one, yeah. So here we have a 5R. It's got an extender on it, but don't worry about that for now. Just the green part. See how that green part is a little bit longer? We call this the classic frame. So we've ordered this with classic style. And the reason I might do that is because, good example, I need to do car transfers. And so I don't want to tick those caster arms out too far. It's going to make a bridge too far to go. But I still want it to be anteriorly stable so I can do my transfer in front of the wheel, because that wheel's going to hurt my bottom. I can make it the classic frame style. It also gives me a little bit more grip for a easier transfer. Okay? So that classic extra would be for ease of transfers, making the chair a little bit more stable anteriorly. Considerations: makes the wheelchair footprint longer, less maneuverable. This one has a classic frame. This chair has the standard frame, okay, the normal frame. And you can hopefully see that this one, that bend in the frame happens pretty quickly. This one, we have extra frame before it bends. Okay. Would you like to add anything else in terms of the math, the arithmetic that you do in terms of seated depth and your backrest?
Only that what we're talking about now is really absolute measurements, and these are really great for us to start thinking about, okay, what sort of wheelchairs might we bring out on a trial to accommodate your client. The next step for us would be to get some chairs together to come out and do a trial, and we'd really be taking some comparative measurements. What changes would we be making to the trial chair that we put the client on to provide a really good fit and functional product for the client? So it's a little bit of a different approach as a dealer, in that we're often taking the starting point of a demo chair and we'll use that as the basis for comparison to the finished product.
Yeah.
Nonetheless, these measurements are really important for us to try and get as close as we possibly can for sort of the trial equipment that we might be bringing for your clients.
Yeah, and I think that's a nice way to put that. Let me just backtrack a smidge. That's exactly what we're trying to do here is if you provide the absolute measurements, then obviously during the assessment, after the assessment, those need to be translated into the wheelchair measurement. But if we get these nice absolutes pretty darn close, it makes the whole trial process easier, more successful, more efficient. Yep. I'm going to start calling those absolute measurements. That's lovely. I like that. Okay, and just another schematic, because I was afraid that that wouldn't show as well on that diagram. Just remember that the seat depth of the wheelchair is typically from the front of that back cane to the end of the upholstery. And then seat to floor height of the chair is very important for functional aspects. Got a measure for me? Yeah. Functional aspects, and also to make sure that we are accommodating leg lengths. So the seat to floor height is going to be from the ground to the top of the tubing at the location in front of the upholstery here, okay? Sort of where that bend starts. Front seat to floor height is going to be about someone getting underneath systems, underneath tables, or making level transfers to their bed, to their car seat. You also can use this measurement plus their cushion measurement, plus their seated height to allow for entry into a space. Might be important for small minivans. Again, a little bit of our math here, but that's something that we need to consider. Okay, so front seat to floor height. And then we also have rear seat to floor height. I'm making this hard on this chair. Rear seat to floor height is going to be similar from the ground to the top of that frame at the back. This is what's going to set us up for dump or squeeze. And this is the tilt that we give the chairs to make it easier to sit, to allow for a more easy posture, a more efficient posture, better ergonomics in the push. Okay? And that is, we call that either dump and or squeeze. So if you just have a difference in front seat height versus rear seat height, we're going to call it dump. And this one doesn't have very much dump in it, about an inch. About an inch, okay? So somewhere around 17 in the front and 16 in the back. I would use that amount of dump for someone that had pretty good trunk balance. They were an upper extremity propeller. Didn't have any big asymmetries. I might have more, that gray one behind us, a little bit more dump in a chair, someone that's a little bit more active, or somebody that has a higher level of injury. They need more support from gravity. More like, she's 16 in the rear on this one.
And 18.
So we've got 2 inches of dump in that wheelchair, okay? Some things to consider. There's been a lot of research about skin issues and integrity in the amounts of dump and squeeze. And they found that there's no difference in terms of the amount of skin breakdowns if you have a lot of dump and squeeze versus if you don't. In spinal injuries, you know, it's a pretty good cross-section in these research studies. And I think the reason they didn't find any increase in pressure back there, even though they were dumped, is because their posture was better. And remember, if I make somebody sit in a really flat chair and they don't have the muscle integrity to stay upright, they'll slouch. They'll posteriorly rotate. And then instead of having a lot of the weight on their nice hamstrings, yeah, and their femurs, now it's all going onto their sacrum and coccyx. Okay? So don't worry about skin integrity. You may need to worry about them being able to get in and out of the chair over the wheels if you have a lot of dump. Okay? In terms of skin integrity, it's probably better for them. The more dump you put into the system, the more you probably need to add squeeze. So Chili, you'll show us that amount of squeeze. No squeeze is 90 degrees at the seat to back angle. If we put a lot of dump in there, bulk, like your dentist chair, now we're more looking at the ceiling. We better close up the seat to back angle. And that happens in a lot. And we can go somewhere in between that, and that would be what we call squeeze. So squeeze is if we reduce the back angle from 90 to 80, something like that, okay? And a lot of our rigid chairs, you can see, have a little lanyard where you can self-adjust that. It's got a little string in the back, and it releases the pins here so that you can open up that seat to back angle, change your amount of squeeze. Okay. Good. If your client doesn't want that to be altered, we can fill in those little holes so it'll always go to the same spot. Sometimes I think it's nice to be able to change that, that angle throughout the day. And maybe show us how that folds, just so different. Okay. So that's an open frame rigid chair. You can imagine if we take those wheels off, take the armrests out, it's a really small thing to load into a car. Yeah. And then back open into those various squeeze dimensions. Cool. Now if we go back to measuring. Next is back height. All right. Back height, again, from her seated surface to shoulder height. Okay. Or you could measure it to whatever you want your back support surface to be. So if I know that Tilly is going to be an active wheelchair user, she's pushing that chair, we're going to put a little bit of squeeze in there. Well, maybe I'll sort of facilitate a posture, figure out how high that back support needs to be, put your hands on, ask for a little bit of dynamic balance. Hey, Tilly, can you put your hands on your head? Okay, if all of a sudden she's wobbling all over the place, I might need to move up my support. Okay. Hey, can you reach out with your left? So whatever you want to do for your dynamic stability, figuring out where that back height needs to be. Also, you might be considering the back angle and also whether you need to build in some contouring. Okay. And then we'll take whatever measurement from her seated surface to the top of her shoulders, to where that back support needed to be. Sometimes I'll also just take to the inferior angle of their scapula, just so I know where those locations are. Okay. Do remember that I'm taking that from a seated surface. You need to consider the cushion that you're going to be using. If you're using regular upholstery, my back height on my wheelchair is measured from the seat upholstery to the top of that back. Okay. However, when I add my J Fusion cushion, now I've used up a lot of that back height. Okay. So take that into consideration if you're using upholstered back. If you're changing it, getting rid of this and you're adding a J3 back, well then you'll probably mount the J3 back right at the height of that cushion, so you don't have to do that subtraction. Another consideration with that back height is where your push handles might be for your care. Okay? I don't have any on this chair, but they would be at the back height of the wheelchair. Okay. Move to that way. Okay, so again, the back cane or the backrest height of the wheelchair is measured from the seat upholstery to the top of those canes. And we'll be pretty specific that the back height is to where that cane starts bending. That's what we determine here at Quickie what the back of the chair height is. Okay. And then lower leg length. Talked a little bit about the front seat to floor height. Her lower leg length is going to impact the availability of the front seat height. With the shoes that she's typically going to wear, we'll take her lower leg length measurement. I'll typically put the little tab of my measuring tape underneath her heel, and then stick my middle finger or whatever finger in the popliteal fossa, and that would be her lower leg length. Okay. That's the client lower leg length. We're then going to have to translate that into the lower leg length of the chair. Okay. Remember that she's not sitting on a cushion right now. You need to take that into consideration when we translate it. Make sure you measure left and right. They could be different, or it's just a really nice cross-reference for you. Okay. When I translate that into my wheelchair measurement, the wheelchair is going to take it from the foot plate to the upholstery. And that's the seat to foot plate or the lower length measurement of the wheelchair. Realize that when I add my J Fusion cushion, I have now made that distance longer. Okay, so you have to, when I'm translating this, you have to subtract the wheelchair leg length. You have to subtract the cushion height. Okay. Again, Jeremy and the team is going to help you with that. If you get the absolute measurements, make sure that it translates to the chair. Other thing to consider with that lower leg length measurement, I always, at least in the Western world here, I always think that this measurement here is about the lowest seat to floor height that I can do on my wheelchair. I typically want to have 2 inches of space between the foot plate and my floor. And so now that leg length, we're going to put her on a cushion. So if her leg length is 18, somewhere around 18 inches seat to floor height for the wheelchair, it's about as low as I can go. I'm going to raise her up on this side and give me the ground clearance down here. Have we lost?
No, not yet.
And we're just making sure we're all still on. We had a little bit of a glitch in the video. We think we're good.
Looking good from this end, Amy.
Okay. And then just a couple more measurements in terms of the wheelchair. After we take a break here, we'll look at the propulsion and how to make this as efficient as possible. And during that, we'll refer to the center of gravity of the wheelchair, or shortened to COG. And the COG of the wheelchair is measured from the front of the back canes to the center of the hub. We measure it in either inches or in centimeters. The bigger the number, the further that wheel is forward. Okay? The further it is forward, obviously, the more tippy it's going to be backwards. But the more forward, typically, the more access to a good push I have, and the more weight I have on the drive wheels, which makes it a really nice pushing machine. Okay? So that COG is going to be very determined on the overall frame length, your client's height, weight, where their body is centered. Okay? Just realize that COG, the bigger the number means the further forward the wheel is on the frame. On all of these chairs that we've talked about, it is adjustable. We'll show you that when we get to each of the individual frames, but realize that you can adjust it after it's been ordered. But sometimes it's really nice to have it perfect as it gets delivered and rolled in and not have to get out your tools. Okay, and again, just a side view image of that COG. That COG is going to affect the overall frame length and the footprint of that wheelchair. Obviously, the shorter the frame length, the less space it's going to take to turn, the more maneuverable it will be. So we'll try and minimize that footprint while giving them enough stability and appropriate push style. Okay. We're talking about frames. We'll also refer to the frame angle or the hanger angle. Most typically, if I'm talking about a rigid chair where these guys don't move, we'll call it a front end and the angle of that. The bigger the number, the closer in that front end is. So this would be an 85-degree front angle. And you can see that that measurement is taken here. Okay, so the bigger the number, the closer, this more straight down that frame is going to be. Conversely, if it was like a 60-degree, it's going to come more out to the front and be an overall wider footprint. Longer footprint. Also affect the knee angle, obviously. Okay. If we're talking about a folding chair, we'll typically call them hangers. They remove, we'll call them hangers, but the same applies. 60-degree hanger is going to come out further. This is a 70-degree, 80 and 90 would be straight down. Same implications in terms of maneuverability, knee angle, even caster clearance, especially in a folding chair. We have to consider, do I have space for that caster to turn? Again, some nice just diagrams about how we determine that front end angle or the hanger angle. We can also inset the frame. And so the white chair, I took too much space. The white chair, this is a Xenon. It's hard to figure out where the camera is. I told you our camera taking skills.
We're clinicians.
Oh, but now I'm getting the table. Maybe move it back a smidge. You can see though how that frame comes almost straight down. That one has a 1 centimeter inset. Okay. Versus this gray chair that I have, this is a 7R. This has a bigger inset, meaning that it gets skinny in the front. This is a 1-inch inset. I could even bring it in, like in the picture, I could bring it in 2 inches in either side. Okay. So what are the clinical applications of that? It makes it more narrow in the front. It also brings the legs together, so the legs are quieter, they're more positioned, they're not wobbling around. So it can have great implication for posture. Consideration is that it makes the foot plate considerably narrower. You got to remember that we measure our chairs from outside of the tube to outside the tube. If we take a 2-inch bend in on either side, we're going to lose 2 inches on either side. Plus, we have to fit in between the tubing. So my 16 wide wheelchair will become a 10-inch wide foot plate. So for some of your guys that wear bigger boots or they don't want to, they sort of spread their legs a little bit, just be careful that you have enough space, not only for their shoes, but also on the sides of their legs, their fibular head. You won't get into any pressure issues there. And really great posture, shortening the chair, making the chair look really good. Just make sure that you have the space that's required. And again, that's a choice, whether you have none, some, or a lot. Okay. Overall, and same idea, just we started with an 18-inch chair here, and it made 12 inches in between. If we then just look at how that affects our chair, there's our backrest height. Remember that we have to consider the cushion. If you're using the regular upholstery, not so much if you're adding on a rigid backrest. Should probably get back next chair, but we're 2 minutes away from a break, so we'll just go to the floor here. Okay. Wheelchair lower leg length. Make sure that you're taking into consideration their cushion height. Didn't know there was so much math involved, did we? And again, like I said, a lot of times I think that lower leg length of the client is about as low as I can go for my front seat to foot height. I can always go higher, but typically I'm trying to find what's the lowest seat to foot height I can go in an active chair. And just the math again, there's the lower leg lengths plus your ground clearance, which is, let's say, 2 inches on most of these chairs. Unless somebody's got a lot of good wheelchair skills and you know the minute they're on uneven terrain or grass, more softer terrains, they'll do a wheelie, then you might be willing to have less ground clearance. Okay. And then your cushion height will be there. Seat to back angle, we talked about this when we were talking about squeeze. Make sure that you realize what chairs have seat to back angle adjustments and which ones don't. Our Quickie 2 does not have any seat to back height in a typical Quickie 2, does not have any seat to back angle adjustment, but the rigid chairs that we've shown you do have that adjustment. So there's your Quickie 2, where that's going to be a 90-degree seat to back angle, unless you do a special frame where we add that adjustability. You can either do it by the lanyard, or some of the frames will have tool adjustment, so you wouldn't be able to do it periodically throughout the day. I think that's hit all the major components that we're gonna sort of now put together when we look at how we want to push the chair, how we want to configure and set up the chair. Jeremy, have there been any questions as we went along, or have we been crystal clear?
Well, crystal clear to me, and unfortunately, I don't think I have access to that chat section. That's going to be coming through to you guys.
Okay. We'll take
But
a
I
look
have a
at,
couple that I wrote down as we went along. So we touched on seat dump and seat squeeze and the impact on seated posture. There's also an impact, I think, on wheel access that we might not have talked a little bit about.
and that's what we'll do for the remainder of the session, really, is now okay, we know what the parts are. We know what we name them and how they can be changed. Now, how do we change them to provide that clinical benefit, really? Yep.
Awesome. And just another note on transport. We find a lot of clients and therapists surprised at how easy it is to transport a rigid frame chair. You tell people that, hey, we're considering, or it might be worthwhile considering a rigid frame chair, and the first piece of feedback that you get is, well, how am I going to fit that in my car? You know, even just with the folding backrest and removable wheels, a lot of people could fit that in the boot of a car if that was their preference. So people sometimes dismiss that as an option just without having a trial, and it is worthwhile having a go of that sort of chair for a lot of our clients because the benefits are huge to a chair like that.
Yeah. When you think about a rigid chair versus a folding chair, it's probably going to be near half the amount of weight, depending on which one. And you may have a couple more steps to the process, but it is actually smaller in terms of a frame to get in and out of a car. You do have to take the wheels off, fold it back down, but then it's just a very small frame to put beside you or in the back seat. My background is really in spinal injury, and you know, that is definitely we would go for a rigid chair unless we really couldn't make that work, because the frame is so much durable, so much more efficient to push, so much lighter, that in the long term, just so many clinical benefits.
For sure.
Shall we take a break?
Yep, that sounds like a great idea. How long do you think, Amy?
Yep, I'm at 10:45. And I'm reckoning let's take a 10-minute, but I'll try and be back at 10:55. Is that cool? So 10 minutes?
Sounds good to me.
Okay, everybody grab a cup of coffee, muffins on us virtually, and we'll see you in 10.
The catering should be in the post.
Exactly. Okay, see you in 10.
Okay.
We're back. Is everyone else back? Did we have any questions? Somebody was being cute with Goldilocks and the Three Bears. Okay. Hey, Scott, are you out there?
Yeah, I'm here.
Okay, give us your 6 cents worth.
Yeah, I just like summarising from what you gave, the information you gave in the presentation. I do think it is really important to get that kind of baseline information. One, so we know what what we're working with from the client perspective, and how we have to apply that to the wheelchair. But then obviously from Jeremy's side of the fence, if you like, from him bringing in a trial piece of equipment and trying to get it as close as he possibly can, to ensure it can meet the client's needs, but then kind of working around the trial piece of equipment, using that also as a baseline for measurements such as seat to ground heights and what have you, and then applying the client's measurements on top of that, so that you can then come out to a final outcome that's going to really meet the client's needs, taking in all different components of the whole assessment process, such as, you know, transfers and functionality and such. So yeah, it's sometimes, obviously I've been on that other side of the fence from where Jeremy is, but I've also been on the clinician side of the fence as well, and knowing that you can't always get a trial piece of equipment exactly or as close to the client's needs as possible, but knowing that obviously using all the tools we've got to hand, taking the relevant measurements, we can get to that final outcome. And it's just about using those tools that we have.
What are the top 3 questions or pieces of information that you find that people maybe don't give straight away and you're needing to go back to a therapist maybe to get that information? Do you think it's a common thing?
I think it's that baseline information of just simple measurements, seat width, seat depth, seat to ground heights. More often than not, we'll get a client's height and a weight, and then trying to apply that to a piece of assessment equipment and a trial piece of equipment is sometimes quite difficult. And Jeremy, I can see Jeremy smiling. He's been there, but also sometimes from a therapist point of view, that's all the information they have to hand. They may not have even seen the client. So I think sometimes doing that initial assessment, gathering that baseline information, and then putting everything into play is great. And I think, I know from my point of view, I used to send out a trial request form or an assessment form that then follows that whole assessment process through the whole chain of events, which will then allow the therapist to gather the information. And obviously that team approach of being able to get all that information and then applying it to the piece of equipment to get that really nice outcome.
Yep, so just on that, we have got a seating size form hosted in the resources section of our website as well. And if you were looking for a handy little form to fill out to ask some of the right questions, that'd be not a bad spot to start from our perspective.
Yeah. And generally those forms are really good because it's a good prompt as well. Sometimes you may not have thought of something to take into consideration that applies to the equipment. So to have those prompts for yourself, Jeremy, in that form, it's a really nice help.
Yeah.
For sure.
Good. Okay. We move on to sort of the propulsion efficiencies and looking at that. Just like Jeremy said when we closed the first half, hey, we haven't talked about that yet. So we want to know, how do people typically push and how can we improve it? So there's been a lot of research done. If you're interested in this, if you Googled 3 rivers out of Pittsburgh, that would come up with a whole host of locations and people that have done research on the efficiencies of propulsion and how people should be sitting. But basically, when you deduce that research down as well, they came up with 4 different push patterns, if you will. Yeah. And they came up with the arc, the semicircular, the double loop, and the double crossover loop. You close that with the red arrow at the top. Yeah. And so if we go from sort of left to right there, the arc, I call this the granny push. Maybe jump in the chair. Trying to figure out how best to do this here. The arc, you're getting just a very small bit of the handroom access. So if Tilly moves to the front of the chair trying to simulate that she only had a little bit of access to that wheel, she would get what I call a granny push. And she's just a little portion of the wheel and only sort of the front part of the wheel. Okay, remember the rule was, in the very top of the webinar, it was push the wheelchair the fewest amount of times possible with the least amount of force while avoiding extremes of ranges of motion. Okay, we're breaking all those rules in the arc or the granny push, because if she tries to get more of a wheel position, wheel access, she's going to have hyperextension of her shoulder. And probably anatomy was a long time ago for you guys as well, but remember, you have all your shoulder rotator cuffs stabilizers that need to cross underneath your acromion, and they're just going to get impinged and really worked in that hyper shoulder extension. Okay. Other time you might get an arc push is if she's really low on the chair, and so then you're going to have a lot of extension here, and you're probably going to have a lot of wrist extension. Okay. So we want to stay away from those granny pushes. They're the least effective of them all. Let me skip semicircular and go to the double loop. So now the person's got better access to their wheel position, but they're using a lot of energy. So they're pushing, and then they're doing a loop over, and then letting their hands come down. I think probably the most typical pattern that we see if we have people set up well is the single loop. So they give it a pretty good push, they have better access to their wheel, but then they pick up their hand and they are using all their musculature to push, pick up their arm to grab the wheel again. So it's just, they haven't been taught an effective, efficient push. What we want to do instead is give them the semicircular. So not only do they have the best wheel position, okay, they're going from, 9:30, if we consider this a clock face, from about 9:30 on the clock to 2:30-ish on the clock. Nice push pattern, and then they drop their hands and let passively their arm come back to the starting location. Okay, this is really how we want to set up people to push and teach them, educate them about not picking up active in that reset. We want to have a passive rest. And we want the push phase to be as big as the relaxation phase. So it's about training, but it's also about where we want the person sitting over that wheel. When we were talking about the wheelchair before we broke, we looked at what center of gravity was, what front and rear seat to floor height was. It's all really great, but how do we translate that into a good, effective push? Okay, there's a couple, sort of measurement strategies that we can look at if we want to make sure that we're getting that really nice semicircular pattern. A lot of times the first step is that we're going to move that axle, that wheel position forward. So they have a really good access to the wheel. And it also means that a lot of weight for the system is over the drive wheel. We want to have about 80% of the weight of the system over the drive wheel, the big wheel. You come back into screen for us. I'll move my camera down a smidge. Okay, you can see that she's sitting over the top of the hub of that wheel, the big silver thing in the middle. And so that means the majority of her body weight is over that drive wheel. And we want 80% over that drive wheel. If we play the pretend game and she's scooted forward on that frame, way forward, okay, now we're to granny pushes. That's all she's got. Look how hard it is to push. And instead of having a lot of the weight over the drive wheels, now they're on the casters. And our casters are really about turning, they're about stability, but they're also shovels. The more weight we have on those front casters, the less efficient, the less ergonomic that push is going to be. Okay? And, we're just playing the pretend game by moving her forward on the frame, but you can imagine that if her wheels were positioned that far behind her, yeah, and sneak to the side again, and sneak forward. Yep, sneak forward on the frame. If you have a typical sort of standard wheelchair, those wheels are behind them, or our configured chair hasn't been set up properly. The minute we see those big hubs, silver hubs, a fair bit behind her, we know that she's going to have a struggling push. Too much weight on the casters, not enough wheel access. Also might make it a little bit more tippy, sort of depending on which way you're going. And these active chairs, what we're really trying to do is find the sweet spot, the nice balance between being push friendly but stable enough so that they can get out of the chair properly, safely, that they can pick things up off the floor so that they can transfer. Okay, realize that all these decisions are going to impact one another, yeah, and potentially dramatically change how functional, how safe this chair can be. Okay, so our goal is going to be to have that rear wheel as far forward without compromising, without making them too tippy. Other thing we want to do, what Tilly is demonstrating right now, is with a normally proportioned person, we want the tip of their middle finger to reach the middle of the wheel. And we'd also like to have a very nice straight line, a plumb line, from their head to their shoulder to their hips to the hub of the wheel. I always joke and I say hasapawa, head over shoulders over pelvis over the wheels, axles is the best, you know, what we're aiming for, best practice. We may need to alter it a little bit if our client has a high center of gravity, amputee, lots of things, but that's what we're trying to at least start with. The body over the midline and over the hub of the wheel. You can see that Tilly's got a really nice head over shoulders, over pelvis, over the wheels, axles. And another really great measuring tool, have her drop her hands and the tip of her middle finger should reach the center of the wheel. That way, when she goes onto the hand rims, she's going to have a nice shoulder position. She's going to have about 120 degrees of elbow flexion. And most importantly, she's going to have a neutral wrist. If we have a lot of hyperextension of our wrist, we'll have carpal tunnel problems. We also won't have a good push. If we have a lot of shoulder extension issues, again, all those rotator cuff muscles, biceps are in jeopardy. When we're positioned over that, over the wheel that way, means majority of the weight is over the drive wheels. You turn to the front. Might also be good to think about lateral wheel axis. We'd like those wheels to be in as close to the body as possible, while still allowing for, you know, protecting your skin on the sides. We also like to add a little bit of camber to the system so that that follows the biomechanical sort of push strategy of the wheel so that we can push down and out. That's where our strength is. You can see I've just got probably 3 degrees of camber in this system. We measure camber in degrees, and it's the lateral tilt at the bottom of the wheels away from the frame. Okay. On an active chair, a typical amount would be 2-3 degrees, maybe 4 degrees at the most. In our sports chairs, if you look at clients playing tennis or basketball, we'll be looking at 16, maybe even 20 degrees. One thing to consider with that camber is that it does make the wheelchair wider at the bottom, so that you want to make sure that you're not affecting doorway access. For most chairs, I consider that 3 degrees of camber will add an inch to that side of the wheelchair. So overall about 2 inches. Okay. Again, that's a Jeremy thing to help us translate. Just remember, you need to consider a little bit more camber will make the wheelchair a little bit wider. Okay. These are both quickie chairs. This poor girl, this is an older photograph, but on the left-hand side, look at how they've set her up for absolute failure. Okay. First of all, she's really far forward on the system. She's got a lot of weight on those front casters. We've given her nothing but a granny push. And for her, it's more a fact that she's really high on the frame. If you dropped her arms down, they'd only be to about here. And we need to either reduce the size of her wheels or bring her rear seat to floor height lower. And then they've given her the heaviest wheels possible. And then look at the casters. They've given her little tiny baby casters and a long fork. So it's going to get stuck in every soft terrain and every little crack. Plus, with that long of a fork, it's going to make the spin of that caster when she turns really long. So very inefficient sort of setup. With a great chair, but frame is only the start. Remember, we've got to configure it so that it works. Okay. This is sort of the opposite setup. He has got this thing so hasapawad, if you will. He's head over his shoulders, over the pelvis, over the wheels, axles, so short of a footprint. But he's got spina bifida, and he's been in a chair his whole life. He wants this thing to respond completely. He turns his head, the whole wheelchair turns. He wears his backpack. Again, this is a Ho Chi Minh picture. He wears his backpack. He sneezes. He better do a little bit of a chin tuck because he's going over backwards, okay? but he's got the skills to be able to handle that. So just make sure that you're considering where those rear wheels are placed, what the overall center of gravity, the skill set of your client is. And, sorry, realize that, you know, if we want her to propel more effectively, maybe in the beginning stages, we set it up for stability, but on down the road as her skills improve, we can move that wheel position forward and we can change the rear seat height to better accommodate her skills. This is a guy that we saw at the top of the webinar. Again, I told you he was having all sorts of migraines and pains here. He thought it was just due to his spinal injury, but really it was the configuration, the lack of good posture, and the lack of wheelchair access. You can imagine if we have his arm drop down, he's going to be really low on that wheel. Okay, so he doesn't have good access to the wheels, and his posture over the top of it isn't great either. So we changed some configurations, and all of a sudden we have a much better sitting position, a much better wheel access. Okay. We also changed frames. One thing that wasn't doing him any favors, sorry, sort of when he left hospital, someone didn't help him out learning how to do transfers without swinging away the hangers. So he would take his feet off of the hangers, put them on the ground, swing these out of the way, and then do his transfer over. But here we just had a little bit of a training session where let's keep your feet on the wheelchair so that we can have a front end versus those swing away hangers. We can make that wheelchair footprint so much smaller. We can drop your rear seat to floor height, increase your front seat height so we get leg clearance, and then position you well over that frame. Guess what? All of a sudden his migraine headaches basically disappeared. That's the power that we can do with a good wheelchair configuration, a good setup. Okay. So like Jeremy said when we got back together, he said great measurements to start, those absolute measurements, and then they'll bring chairs out to suit those measurements. But then you can, based on that trial chair that they brought out, hey, the wheelchair needs to be a little bit further forward. Oh, we need to drop the rear seat height. We need 2 inches lower for where your wheel access is. You can start with that baseline and modify the chair that they'll eventually receive. How do we make all those adjustments? So we'll show you live here in a moment, but the axle plate, this thing, or the axle receiver, is how the wheel attaches to the frame. And if we have a folding chair, they'll typically have one of these guys, and you can see how it can move up and down to change your rear seat height. Remember that if you move this plate up, it's going to make your wheelchair shorter in the back. If you move the plate down, it'll make it higher. If I have a rigid chair, it'll look something like this, some sort of an axle plate that's attached to the side rail. Or this is a 5R, this is the green chair that we have here, or this is a 7R. Okay. The other thing that we can do with our axle plate is we can move the wheel forward and backward to change the center of gravity. Remember we talked about how the center of gravity is measured from the front of the back cane to where the middle of that hub here. So this is going to be a super stable setup. So is this one actually, okay? But if I wanted to change, make it a little bit more tippy, a little bit more push friendly, I would just loosen off here and slide it forward in that axle plate. Or on these rigid ones, I'm going to slide it forward on the seat rail and move it forward. This one is already a little bit forward. If Tilly pops off our wheel on our chair here, you'll be able to show how easily you can take some Allen keys and slide that section forward on the gray part of the frame. A little bit tricky to see just because it's all black. Okay. And then in terms of changing our seat to floor height in the back, On this particular chair, see how there's the purple little bit? We can remove the black spacer underneath and make it lower rear seat to floor height, or we could add another spacer. Okay, so that's the adjustment on a 7R. We call the 7R a moderately adjustable chair for rear center of gravity. We're going to use that 7R for somebody that we're pretty sure what we want their dump to be. We won't need to change it a ton in the future. If we compare it to the 5R, which is the blue on our screen or the green here live, this one is our fully adjustable axle plate. So you can see that this receiver will move up and down that whole shaft. So on a 5R, I have lots of rear seat to floor height adjustability after the fact. Okay. That's why we sometimes call our 7R the more final, they know exactly what they want, and the 5R is our more adjustable version and the open rigid. We then maybe look at the Xenon. We'll probably come back. So. The Xenon has, the Xenon is our open frame folder. So this is the one that's trying to cheat and be a little bit like a rigid chair. And this one, you can see how that black portion will move up and down on the white vertical. So we've got lots of rear seat to floor height adjustability. And then within our, where the camber is where the wheel attachment is, we have little half moons. So we could remove a half moon and place it back. So I have full adjustability forwards and backwards on this Xenon open frame folder. And maybe give that one a fold while we're here. And show that before. So that chair will fold in half and lock into position when we caught them. I like the Xenon because it has, you know, I'd much rather a rigid chair for all the reasons we talked about before. But if the client has convinced me that they really have to have it fold for how they get it into a car, where they place it at home, whatever, I really want them to have a more durable, rigid feel to the chair, that's when I'll choose the Xenon. Okay? It's open, so it's a really lightweight chair, but it folds, and it makes it that one next step easy to put into the car because it locks into the folding position. You see there's a little thumb release here, and it locks into place. If I have a spinal cord injury and I'm transferring out of this into my car seat, I'm a little bit unstable. The worst thing is now I'm in the car and my chair unfolds itself. So this always stays locked, folded, and then I can pull it into the car. It also helps me lock this chair. Before you do that real quick, I told you it was sort of a fake or a cheater rigid chair. And that's, we say that has rigid qualities because it's really clamping onto seat rails and going into these U-locks so that when Tilly presses that down, it's going to lock the frame into that down position. Okay? That's one way we're really trying to rigidize this folding chair. And then if we pop a little wheelie, I know we've only got one wheel on, but we also, the cross brace is quite a bit narrower, shorter than in a traditional folder. Again, we're just trying to make it that as close to a rigid chair, but still fold in this Xenon product. Okay. The other thing that's quite nice, it's got an auto fold foot plate. So you'll see that they don't have to do anything to that foot plate when they fold it. It just comes with them. And then when they put it back down, and then the weight of their legs will fully put that foot plate down. Okay, that's just a nice feature, so they don't have to worry about the foot plate. If you had somebody that needed to put their feet on the ground to do a transfer, you can do a pull-up one so they can get their feet down. Okay, stolen all the wheels. We did talk about camber when Tilly was sitting in the chair. This is a nice visual of a fair bit of camber. Just again, be careful. It does make the bottom of the chair a little bit wider. The good things about camber, it's always got more lateral stability, better turning. That's why we use it in those sports. And again, it follows that biomechanical path of the shoulders so that you're doing a really nice efficient push. I guess before we put all the chairs away, just remember the camber adjustment. If you're on a rigid chair, it's going to require a new part. So the camber is selected by how it attaches to the chair. So if we want to change the camber after the fact on a rigid chair, we'll need this new part. Versus on a folding chair, I'll show you here on the screen, we can just sort of tilt out this axle plate by adding some washers. So a folding chair with this type of axle plate, you'd be able to adjust it in the field. And he doesn't have a lot of camber in that chair, okay? Probably because he really wants it to be super narrow. Whereas Charlie here, he's a quad, he's got more space in his house, he's got a fair bit of camber there. Okay. All adding to some really nice maneuverability. It's a great picture, just where you can see he's really well centered right over the middle of that wheel. Okay. Even if our clients aren't, active paras, if they have cerebral palsy, she's a really great example of someone that pushed really well in a manual chair when it was configured well. She's a diplegic, a little bit of a hemi. This left arm doesn't really quite work as well as the right, but she made the choice that she really couldn't manage power in her house, transport. She couldn't go to the friend's house that she wanted to. So it was very important that we set her up with a really push-friendly manual chair. And that was making sure that the wheels were directly underneath her so she had good access, and then also putting a fair bit of camber into the system, which is what demonstrating in that picture. Spina bifida here, we just really can't give her safely that supple walk position. If we put head over shoulders over the pelvis, she's going to be really back tippy. So they are considerably behind, but as good of a push potential as we can. In her case, we've used a little bit of tension adjustable upholstery because she had sort of a big booty back here. We could let some of that sneak out the back. You could also use like a J3 plus backrest to do the similar. Just somehow let her sit into that chair as far as possible, and then find her happy spot, that halfway in between, or the happy spot of maneuverability and stability for her. But really nice caster position, caster choice, so that we've got a lot of the weight over the drive wheels. We've got nice maneuverable casters, well positioned hangers. And I really like this picture of Charlie. He's, I think he was injured over 40 years ago now, probably even more. He's a quadriplegic. He's been a full-time manual wheelchair pusher his entire life. And he's been able to keep healthy, to keep active because of how well he's positioned in that wheelchair. You'll see head over shoulders, over the pelvis, right over those wheels axles. He's got great push potential. He's got a pretty good wheelchair footprint. Only thing I haven't been able to convince Charlie to do is to go to a rigid chair. He still loads this chair in and out of his car multiple times per day. So for him, it's really important to have swing away hangers, fold it in half, and just sort of he wheels it back behind him. And that's just worked really well for him. He's not willing to change. So if it's working, yeah, if it ain't broke, don't fix it. But really well positioned in that chair to give him the postural support that he requires. If you look at his chair, he's got a fair bit of dump in that system. Rear seat height versus the front seat height. and he's really active. This is a picture of him. He lives in Massachusetts, actually, in the United States, and he's always out either sailing or kayaking, or I think at the end of the slide deck, he'll be in his four-wheeled buggy that he creates. So he's a really active guy, and he does that because he's got such a great system. He's just been able to make full potential out of his life. We look at this young lady. She's a para, little bit of seat dump in there. And here we've got a gentleman with a fair bit more seat dump. When you have quite a bit of a rake, I guess that's another word we could use for that, you might consider closing up, squeezing that back angle so they get a nice bucketed approach to their pelvis, make sure their pelvis doesn't rotate backwards, and they've got good push, good posture. It's the last thing that we'll talk about in terms of the chairs is how do we determine the wheels, the tires, the hand rims, and then the casters. And when I'm trying to determine that, I always think about where are they going to go, you know, what sort of distances, what type of terrains, and then also what are they going to do if they get a flat tire? Does the whole world end, or are they able to change it, get to a bike store, that sort of thing? Okay. We'll take the wheels, the tires, and the hand rims as a package, and then we'll look at the front casters. But realize that these ideas about where are they going to go, what sort of distances are in a, you know, they apply to both the wheels, the back wheels, and the front casters. There are lots of different options. Each of them have benefits and considerations. Mag wheels, they'll typically have black spokes. They're a polycarbonate sort of material, a composite. The nice things about these is there's never going to be any spokes that go out of alignment. The spokes won't break. Some of our newer mags like these, we call these 5 spokes. They're nice and round, pretty lightweight, no maintenance. They are a little bit heavier and they are quite a bit stiffer. So you're going to sacrifice on the absorption that would happen with a regular spoke wheel. And we do have a set of those. Next time we get together, perhaps we'll have you try all these wheelchairs. But for now, just virtually. So there's that 5-spoke mag. Okay. No spokes to come out of alignment, no spokes to break. And all these wheels that we're going to talk about, they'll come off. They'll have a quick release button, and then they'll somehow add onto the chair. Okay. It's a semi-adjustable axle plate. Too. Okay. Very good. Spoke wheel or a light spoke. These are the light spoke are really nice all around type of wheel. If you're looking for the lightest weight possible wheel, that's going to be our ultralight spoke. Okay. If you're looking for our strongest and lightest wheel, most durable, it's probably going to be in the Spinergy family. And Spinergy is a company that all wheelchair manufacturers use to provide wheels that are super absorptive, super duper strong, and light. And they're basically, I sort of consider them like a really fancy tennis racket. Just you know how a tennis racket is strong? Basically, there's thousands of carbon fibers that then they enmesh or they cover in a carbon plastic material. And then they string it really tight, so super duper strong and also really durable but absorptive. So it's going to give a little bit. These would probably be a really nice wheel to use for somebody that has steps to bounce down, curbs. They're going lots and lots of distance. And then the company Spinergy makes them in 18 sort of spokes, the number, or the LXs here have 12. So that one's just going to be a little bit lighter and looks, I think, a little bit cooler. Okay. And then you have your mountain wheels. This would be like a mountain bike wheel and tire package. This might be useful for somebody that's going out and about, uneven terrains, muddy terrains, soccer fields. I just realized that they're going to bring all of their outside inside because it's got a lot of tread. Also makes the wheelchair a little bit wider. And then we have different tires. And tires, again, think about how much they can tolerate a flat tire. I also like to consider how much tread they might need. So this tire that I have here is what I would consider for a very active user that doesn't need a lot of tread, sort of like a high energy bike rider tire. No tread, we got a lot of pressure in this. If I go over a thorn, this one's gonna go flat, okay? So if I'm gonna use a high pressure clincher, down here on the bottom, I'm gonna, benefits, it's gonna be really nice rolling, not a lot of resistance, but it's gonna be probably the most prone to flats. And it also doesn't have a lot of tread, so that I won't have a lot of grip on maybe a vinyl linoleum surface. On the other end of the spectrum, I have a full poly tire. This one is solid rubber. So there's no air in it. There's never going to be any maintenance. It's got a fair bit of tread on it. So it's going to have nicer grip. Okay. You're going to use this for somebody that you can give a little bit on the performance. It's going to be stiffer, but no maintenance. Okay. Just isn't going to go flat. If we could have our pneumatic wheels, sorry, pneumatic tires. There are gray ones with tread. I can either have an air tube in there, so it's going to have some give, or I can put a foam insert inside, like here on the slide deck. That way I get the tread from the tire, but I don't have to worry about the air insert inside. This is probably sort of a less expensive all around. You love good performance, but you really don't want to have any maintenance. This is probably my favorite tire here for when I want everything and less maintenance. This is like your Tuffy bike tire. We call them the Marathon Plus. Schwalbe's the company that makes them, Schwalbe Marathon Plus. Basically, it's got an air tube in there, so it's gonna give, it's gonna roll really nicely, but it's gonna be resistant to punctures because it has this extra rubber strip there. Okay, so if you want it all, do a Schwalbe Marathon Plus. This one will be a little bit of an upcharge, so you'll have to justify for that. Another great, if you want all around tire, less maintenance, would be this pneumatic with an insert. This one's going to be your bike tire. If you've got somebody that goes 10 kilometers every day, they're wheeling like crazy and they're using up their tires and you need to replace them often, you can do a shocks. So this is like that full poly, except the material is much, much denser, so it's going to last a long, long time. Okay, bit of a rigid ride, but for those super active people who want to last a long time, shocks is a good option as well. And then you have some outliers, your knobby, so extra tread, extra traction, or a mountain tire if you went with your mountain wheels.
Hey, Amy, I just don't mean to interrupt. I just wanted to point out, just because of the time we're at, there might be a few people who might need to head out. Just wanted to add to them, this session is being recorded, so we might keep it going. And if anyone needs to head out, we will have the recording later that you can tune into the rest of it. Just wanted to add that quickly.
Yep, perfect. And we're probably 5-6 minutes, I bet, at most. Okay, but if you do have to go, thank you. We really appreciate you being here. Okay. In terms of hand rims, the standard hand rims will be similar to what I have here. Aluminum anodized is what we call that. We can put a plastic coating on top, and that'll give you a little bit more grip. So for people that just don't have the same strength or fine motor control. We can also do a neoprene coating, which is very similar to the plastic coating, except it's just going to last long and it'll be more resistant to nicks if they run into doorways, thresholds, things like that. And then we have a series of ergonomic hand rims. which are either called Natural Fit or another company that makes an elliptical version. Basically what that does is instead of having a round hand rim, makes it just a little bit more oblong shaped so that it can match the shape of the wrist, open up that grip a little bit and avoid overuse injuries like the median nerve. And then we can do lots of fancy stuff to that oblong hand rim. This one's called the Surge, and it actually has a little gription, a little tacky part on the top, so it adds some grip strength. Or you can put an entire connector between the hand rim and the rim of the wheel, so that then my thumb can actually get into the process and push on the wheel as well. Natural Fit is the company that makes these, and we said, hey, we love your hand rims, but they're a little bit of extra weight onto the frame, so they now make them in a lesser weight frame, a lesser weight version called the LTs. Okay, just realize that those are really nice ways to further that ergonomic approach and make sure that people are getting good connection with their hand rim and have a nice ability to push the chair. Casters, we talked about how they really should only have 20 to 30% of the weight of the system. Remember, it's not just about the diameter, it's also about the width. And us as manufacturers are getting better at providing fatter, smaller casters. So they're maneuverable, they don't take a lot of space, but they're fatter so that they actually don't get cut in the nooks and the crannies. Okay. This is a 6" by 2.5. Okay. And we can also sort of choose the different materials so that you get the right sort of surface absorption. Most times we make casters solids, because anytime you have a pneumatic front wheel and it goes flat, you're not going anywhere. So very typically, we're going to put one of these soft rolls on there for our active clients, or a semi-pneumatic. Don't be fooled by this name. That semi-pneumatic just means that we're trying to make it feel like it's a little bit softer. There's no air in this one. Gives you a full profile, a really nice rolling caster. And those, depending on your chair, can come from a little baby 3 all the way up to a 6" on these active chairs. If someone's using a really small front caster, make sure they've got wheelchair skills so that they can get those out of the soft terrains and just use their rear wheels so they can get into a wheelie. Just wanted to real quickly show, here's a young lady that needed to deal with her posture a little bit. She's very active, loading and unloading her chair multiple times a day, ending up in a really nice configured posture over that frame, head over shoulders, over the pelvis, over the wheels axles, in a open frame folder. And we've also managed her posture by cushion, a low backrest. She's just demonstrating for me how she's managing her scoliosis. And then she also sent me this picture because she likes to show me what she does outside of using her wheelchair. And then she was in some sort of, oh, maybe I don't have that picture. I don't. She did also send me a picture of her indoor climbing wall. So she's a full para. She's on a climbing wall at the gym. There's lots of places anymore to get more information about helping people learn wheelchair skills. One of my favorite websites is wheelchairskillsprogram.ca. It's a Canadian website, and they have all sorts of skills that you can just download. These are clickable on the left-hand column there for how to train people, how to spot people if they're learning. Just a fantastic website. Some of the videos are getting a little bit old now, but they still it's a great site, very inclusive, and everything manual wheelchair. I also love seating hip hop with Mary Allison. If you Googled hip hop, She comes up with all sorts of great webinars about wheelchair skills. So if you just wanted to give those, get those in front of your clients, it's a really great website. Anyway, Google or on YouTube, you'd find those quite easily. Sneak into the frame. We ended up on the floor like all good therapists. We start on a chair and then go to the floor. Any questions or sort of comments on that? We'll go Jeremy first.
A few musings from the presentation, which is great, by the way. Just a caution on those rubber-coated hand rims. They work great during a trial on flat surfaces, but they can be pretty rough on the hands if you try to do braking operations with them. We found that with a couple of clients, so just think about that during a trial. And one thing that we see quite often is a push for really big casters on a wheelchair as a means for improving the outdoor performance. And I feel like sometimes we overlook center of gravity adjustments in favor of really big casters. I think, if anything, the center of gravity of a chair is more impactful on the performance out and about than the sort of incremental change you get from going up an inch in caster size.
Yeah, absolutely. And width. You can stay with a 4-inch or a 5-inch caster and make it 1.5 inches wide and make a tremendous change. And then yes, if your center of gravity is more appropriate, you're going to have less weight on those casters. They're not going to dig into the uneven terrain, the soft terrain, get caught in the cracks. Absolutely. Any other musings?
No, that's the extent of my musings today.
Scott, are you still out there?
Yeah, I'm still here. No, nothing to add from my end. Just, yeah, once again, a great presentation. So thanks very much.
Yeah, and realize that, this is tricky to put all this into an hour. But I think we've all already said that the assessment, that initial assessment about where your client is going to go, what do they expect it to do? What are the absolute must-haves? What do they do on a daily basis? What's the narrowest thing they have to get in between? What's the shortest thing they have to get underneath? The more investigation you can do at the beginning, the better the first trial will be, and probably the more successful the entire process will be. Tilly's just checking out questions. Do you have any musings? I like that word. Let's use it one more time. I'll sneak you back into the frame.
No, I think everything's been covered, but I think as a clinician, you are the real expert on your client. So, continue to build that rapport with your client, find out what the must-haves are, what are the key measurements to take, and, work with Jeremy and his team to find that perfect match between all of the options on the wheelchair, and ask as many questions as you can to really paint the picture and get that set up right on the wheelchair. And it might take more than one trial to do that, and that's every time it'll get more efficient. Better to ask the questions at the start, then call us after the chair's been delivered and say, oh, can I make this change to a rigid chair or something like that? So ask the questions.
And I'm going to put that last slide up there. We will make available this recording and also maybe our assessment and the wheelchair measurement videos. So we'll give you access to those through an email along the way. Here's all of our email addresses. If you have any tricky clients or questions to ask, please either send them directly, or we have a full-blown clinical email address. Happy to assist in any way that we can, and know that Scott is on the ground in Victoria, ready and willing. Okay. Jeremy and team, thank you. We really appreciate you guys moving this to virtual and giving us the opportunity. So keep up the great work.
Yes, thank you,
Thank-
Amy and Tilly.
Thank you all.
Yes, and to everyone, as we always do with our clinical education, we will send you all certificates of attendance and a link for some feedback if you have a few minutes. So you'll all receive that shortly after the session ends.
Perfect. Okay.
Excellent.
Bye, guys.
Thanks, everyone. Stay safe.
Thank you,
Thank you.
guys. Stay safe. Bye-bye.
Bye.
Bye.